The opioid crisis is really probably the biggest public health crisis that we've faced in this country in a long time. And despite a lot of efforts that are underway right now to change the course of things, with each successive year, we've had a greater number of overdose deaths. And the deaths are the thing that are getting the attention of the media, but there's just a tremendous amount of fallout aside from the overdose deaths, including transmission of infectious diseases, loss of parents, loss of the structure in the family, high rates of incarceration for minor drug charges. And so this crisis is really tearing apart the fabric of our society, and I think that it's going to be felt for generations to come. We have a lot of scientific evidence around what can work to change the course of the current crisis, but we haven't historically had very organized structure around treatment for substance use disorders in the United States. And part of that is just that it has historically been separated from mainstream medicine. And what's really needed is for it to be integrated into general medical care because the problem has become so pervasive. President Capelluto has been very interested in this issue because it has such a great impact on the Commonwealth, and he comes from a public health background himself, and he has spent a lot of time reading and educating himself about the crisis, and he and I have worked together on a number of things over the last couple of years with the aim of really trying to make a difference in the community. At the University of Kentucky, we have a tremendous number of faculty who are very skilled and very dedicated and are recognized as national experts in their fields, doing work on different aspects of the crisis. And so we really have a large group of talented and concerned faculty that are focused on this. And I think it positions the University of Kentucky to really make a difference. And I think that President Capelluto recognized that when he had the opportunity to see some of my colleagues present at a meeting that we had where we invited the director of the National Institute on Drug Abuse, Dr. Nora Volkoff, to come from Washington and hear about all the good things that were happening here. President Capelluto then had the idea of focusing the Board of Trustees meeting on this crisis because he saw it as an opportunity to have the trustees learn more about the origins of the crisis and the current public health impact that it's having more people understand the dimensions of it, understand the evidence around interventions that work, both in the business community and in the political arena for people who have influence over making policy decisions that actually impact our ability to deliver care. That's the next step. As scientists, we know what works, but having that science implemented in community settings is the next step. And that's one of the things that we're working on now. So the more we talk about it and the more we educate people, we think that the more traction we'll get with changing the course of things.